I'm a level 1 nursing student, and my clinical instructor has assigned me to observe you today.
Hi, Karine. My name's Heather. That's great. Ask me any questions you have.
Thank you. I look forward to learning a lot. So you're taking care of the patient in room 529, right?
Yes.
Do you have time to give me a report?
Sure. Miss Marta Yarn is in 529. She's an 80-year-old female. Has no known allergies. She is widowed. She lives alone, but she does have 2 children. They don't live in state with her. She actually came in with a non-healing sacral ulcer. It's about 4 centimeters diameter, 1 centimeter depth. The edges are macerated, so we did clean with normal saline and covered it with a hydrochloride dressing. She is scheduled for surgical debridement tomorrow, so right now she's on a full diet, but she will be NPO as of midnight. She's got full range of motion. She did have a 6 out of 10 for pain. It was pretty sharp, but we did administer oxycodone. She gets that every 4 hours. She also gets morphine every 2 hours. So right now her pain is low. She's ANO times 4. She is a little anxious right now, but she does sound good. Her lungs are clear, even effortless. Her heart sound good. All her pulse is +2. Cap refill is +3. Less than 3 seconds. Sounds good. All 4 quadrants have active vowel sounds. She's had lower back pain for the last 3 months, but she did say acetaminophen helps her. And she has had multiple admissions for community-acquired pneumonia and dehydration. And her last admit was about 6 months ago.
Okay.
So we do know, looking back on her past, that gentamicin is okay to give her.
Okay.
Right now she has some stress incontinence with nocturia, but that's not all the time, just occasionally. We are going to be administering some gentamicin soon, and right now she does have an IV in her right hand. It's normal saline with potassium chloride, and that's going right now. Her last set of vitals was temperature of 99.1, 88 heart rate, pulse, or 88, 92 oxygen, blood pressure was 144/90, and respiratory rate was 24. She does have decreased appetite, so she's not really hungry. We're trying to get her to eat. She's able to ambulate with a walker, and she's cooperative. And I believe that's it for right now. Her labs are currently pending. Okay?
Okay, thank you so much for giving me a report. Do you mind if I ask you a couple questions regarding the gentamicin?
No problem. What questions do you have?
Okay. Why specifically is your client receiving this medication?
Well, she does have an infection right now, so we are treating that with the antibiotic, and we want to make sure that it takes away that infection before it gets worse.
Okay, so what does the gentamicin do to the body?
It inhibits bacterial protein synthesis, so it's a bactericidal, so it does kill, and it terminates any, it actually does premature termination of the growing polypeptide chain.
Oh, cool.
So it's primarily for infections from aerobic gram bacilli.
Oh, okay.
Mm-hmm.
And when should you question administering this medication?
Well, with her, she does have a little bit of hearing loss right now, but you definitely want to question the hearing loss and the ototoxicity for this medication. You want to question, so pre-existing hearing loss, she has any impaired renal function. You also want to make sure she's not hypersensitive, which we know as of right now she has not been. She's been treated before with this. And yep, that's it for those.
Okay. Does this medication have a therapeutic serum level?
No, it doesn't. We actually monitor the peaks and troughs. So the peak would be 30 to 60 minutes. We want to check that after administering it. And then our trough would be to check right before we administer it again.
Okay. And which vital signs do you monitor, and the physiological parameters do you monitor?
Obviously, we want to check temperature, respiratory rate, blood pressure. We want to monitor her level of consciousness. We want to definitely monitor any hearing loss. Is a big one. We want to check for, make sure she's not having any febrile seizures.
Okay. And what interventions do we teach the client to ensure the medication is administered safely in the hospital?
Well, in the hospital, we always want to make sure she's not having any pain in her IV site. We don't want it to infiltrate. And we also let her know how often, so she knows to get gentamicins every 8 hours, just in case there's any problems. And then, of course, to make sure that the medication is clear, stuff like that.
But what about the interventions at home?
At home, well, this medication is not available orally, no PO. So she wouldn't be receiving this medication, if she would probably receive another antibiotic. So we definitely, first thing is to make sure that they know to always take the full course of antibiotics. And then we want want her to call her doctor if she experiences any adverse reactions. Those would be obviously a fever above 100, any level of consciousness changes, she starts to lose her hearing and she, is aware of that. Dizziness, syncope, wheezing, rash, urticaria, difficulty breathing, and then of course nausea, diarrhea, dizziness, tinnitus, of course, like I said, anaphylaxis is a big one, nephrotoxicity, definitely.
So those are all the side effects and potential adverse reactions?
Yes, they are.
Oh, okay. Now, how do you know that medication is effective?
Well, this one would be if her infection goes down, and definitely, hopefully, she won't experience any oto or nephrotoxicity with it.
Well, thank you so much for answering all my questions.
All right, sure. Any more questions before we go in? Just so you know, the patient does have the right to refuse when we administer, okay?
Oh, okay. Thank you.
No problem.